Hi, everyone. My name is Oyin Penny. I'm a nurse practitioner with Premier Gastroenterology of Kansas City. Welcome to my MASLD community network. My topic tonight would be on MASLD and managing the complex patient with MASLD and alcohol liver disease. So one of my questions that I often get is, how do you effectively screen and quantify alcohol consumption in a patient that has MASLD and MASH? One of the things that I find helpful is to establish a non-judgmental environment when you're seeing these patients. You also want to normalize the topic around alcohol. You can start off by asking questions such as, because alcohol affects your liver, I always ask my patients questions regarding their alcohol use. Tell me about your alcohol use. How much do you drink in a week? When do you typically drink? Do you have any binge patterns? And most importantly, what type of alcohol do you drink? And also, another thing that helps us, another way to detect, to get a more accurate level, is checking a PEth level. PEth level is the phosphatidylethanol, which basically is a alcohol biomarker in the blood that measures alcohol in the blood for about 2 to 4 weeks. Gives you an average of their alcohol use. And that could be a way to detect how much they're actually drinking, especially if you feel that the patient is not being forthcoming with their alcohol intake. And finally, it is important that you are aware of the alcohol that your patient drinks, because especially in the setting of MASLD, alcohol could actually accelerate the progression of their liver disease and also affect or basically determine how you manage their liver disease moving forward. So that's why it's crucial to know how much they drink. Concurrent use of alcohol in a patient with metabolic MASLD has a synergistic hepatotoxicity. So basically, the MASLD and the alcohol accelerate the disease progression. So these patients quickly progress from steatosis to fibrosis, and from fibrosis to cirrhosis. And with that comes along a lot of complications of liver disease, such as HCC. We know that these patients have a high all-cause mortality. They also have a high cardiovascular mortality and liver-related mortality. So it's important to know that if they're drinking alcohol, we need to mitigate this process. So strategies for patients that are diagnosed with MASH, who also consume a lot of alcohol above the recommended threshold, is to stress abstinence, which can be difficult sometimes, but that is the best, most important way to mitigate the progression of their liver disease. Or at minimum, they need to cut down to below the minimum recommended threshold of alcohol. With these patients, you have to set SMART, realistic goals. So SMART is specific, measurable, achievable, relevant, and time-bound goals with patients that are trying to quit alcohol. There are also some helpful apps out there that they can use. One of them is Reframe. They can use that at the privacy of their home if they do not want everyone involved in their journey to abstinence. And it can also guide them as well. Another thing we as providers can do is order pharmacotherapy such as Naltrexone to decrease their desire to drink alcohol. While we're trying to work on abstinence, what we can also do is treatment of their underlying metabolic disease. So if a patient has diabetes or prediabetes, or if they're obese, are they candidates for a GLP-1 or something like that? Do they need to be referred to a dietitian to help with the management of their metabolic disease? I often ask patient questions surrounding why they drink alcohol. Are they drinking alcohol to self-medicate? They have underlying anxiety, depression, or trauma that's leading to their alcohol overuse that needs to be addressed with a mental health specialist. Do they need to see a psychiatrist, a psychologist, or do they need to get into a treatment program such as inpatient treatment program, or are they a candidate for outpatient program? or support programs such as AAs are also helpful. It's also very helpful for them to have a strong family support because that's necessary when they're trying to go through the process of abstinence. I think in the hospital, what's helpful too is having the social workers involved because they know a lot of information about insurance, what insurance covers, all the different resources out there for my patients. So I often will consult them when a patient has a history of substance abuse, particularly alcohol, to get their guidance and helping the patient. Maybe it's transportation issues, maybe it's insurance issues, maybe it's rehab needs, maybe it's housing, transportation to their programs. Those are things that a social worker can also help with. Mental health, behavioral health is also helpful. So we know that ongoing alcohol use can also impact interpretation of NITs and the management of patients with MASLD because we know from experience and we know from what we've taught that patients that have underlying alcohol use has the AST to ALT ratio of 2 to 1. With metabolic liver disease, ALT is actually typically higher than AST. However, in a patient that drinks alcohol and has underlying metabolic disease, those labs are altered. So you really can't depend on that pattern to determine what your patient has. Continuous use of alcohol also delays treatment in our patients because if they continue to drink alcohol, then you can't get the necessary NITs to determine their stage of fibrosis. So then the only thing you can do at that point is managing their underlying metabolic disease. But if it's a patient that drinks alcohol and you get an NIT while they're actively drinking heavily, their NITs will be overestimated beyond what they need. And that is not the time to treat them because even if you consider treating them, the continuous injury that they're getting from their alcohol will actually blunt the response to the drug. So that's why it's important to wait. Most people would say recommend 6 months of abstinence or at minimum, way below the recommended minimum threshold of alcohol intake before doing an NIT on a patient. And I would recommend regular PEth levels on these patients to just kind of make sure that it coincides with what they're telling you before you initiate therapy on them. So thanks everyone for listening to this presentation. Please, if you have any questions, feel free to reach out and continue to log into my MASLD page for future podcasts. Thank you.